not near as bad as it used to be. Also, fun fact about what I've been working on her with is in the beginning when I first started working on her, this was actually not as the lordosis wasn't curved in as much. It was actually poking up higher, so her back was really flat right here, causing a lot of pressure on her lower back. Now it's actually with a lot of different exercises I've been having her do, like some dead bugs with an arched, raising your back up, arched back, and doing a lot of hip strengthening. It's actually helped with that. If you want to look at that, look at our mobility and stability training. So on our playlist. So as a massage therapist, one of the things I think is very important when it comes to lower back work is to make sure to have them open up their hips. So can you bring this knee out? And the reason I have them go into a figure four is the height of this, if it's really, really like, there's clients, it's like way up here. It means their groin is really, really tight. And their pelvis needs some to be opened up and the groin stretched and the outer hips strengthened. But in the meantime, so what we're going to do is I'm going to get right next to the spine. The spine's right here. Kind of grip on the outside and kind of push out. When it comes to lower back issues, as a therapist, make sure you're working as far to the front a little bit as you can. Get inside that iliacus, which is right in here. QL, quadratus lumborum muscle, some oblique stuff. A lot of therapists, when the clients wants lower back work, they just focus on the lower back, which will be a temporary relief. Well, I like to get all the muscles that are involved. So as far as body mechanics, make sure you're kind of leaning in. You can put, as you may have been seeing, put one hand on top of the other and use that to push. Same thing with your thumb, use that and push out. Helps you get a little bit deeper. And then, pretty important, don't forget to work on top of the sacrum. A lot of massage schools, they teach you not to work on the sacrum. But I feel like that's just because if you do it wrong, you can hurt them. But here's how to do it right. You kind of grip through here and just push away. Not too deep, but get some of that tension off a little bit. Helps calm the nerves down. Also with lower back, you want to make sure to get all this through here, the bone right here. You're going to push all that tension away. Ashlyn is our camera person, so if my camera doesn't look good right now, it's all her fault. Just kidding. How are we looking over there, Ashlyn?
I mean,
put her on the spot. So, see how I'm kind of pushing everything away from the bone. As a person who also has lower back pain, I tend to, it's like we know where to press just because we hurt there. All right, what I like to do along with that is, the bone right through here. So I'm going to put my forearm right next to it and sink straight down. How's that feeling there? Okay means ow. Now, anytime you're doing some trigger point work like that, when you're holding a pressure, I don't like to hold it too long. I like to maybe hold it 5 to 7 seconds so that they don't hate you later. But it also helps them relax into it. Kind of work all the way down into the piriformis, because right through here, feel that a little bit more. Yeah. It's where the sciatic runs. This will help really open that pelvis, releasing the sciatic nerve. I have not done a YouTube video in a while, and for some reason seem a little more nervous today. I don't know why. I was on a roll with making these, and then This is my first one in like months. Actually, I made this same one and then the music was too loud, so it got copyrighted. All right, is that starting to feel a little bit better? How does it feel better?
How does it feel better?
Yeah, how was it feeling before compared to now? Putting her on the spot too. She said it felt better, but I wanted to know how.
I felt a little less pressure.
A little less pressure in there. So, and also if you can't reach over the table, you can do the same technique on this side. Put your forearm down here and pressing in. All right. Now, normally we would do both sides, but I'm just showing you how I would do it. So I would do the same thing to the other side. And you go and put this down. We're going to do a little bit of hamstring work. Another interesting fact, a lot of us therapists will tell clients to stretch their hamstrings. Well, if you see a client and they're standing like this all the time, they do not need to be stretching their hamstrings because this is getting real tight and that's getting lengthened. So you want to make sure you look at their posture and everything before you start telling them to stretch. And it's also better to do dynamic stretching. You can look that up as opposed to static stretching where you're just holding a stretch. It can make the muscles very unstable if you do it that way. And everything's just going to tighten right back up. All right. When you're working the hamstring, make sure you go all the way up into the glute with the client's permission, of course. You kind of let them know what you're going to do. We do a lot more therapeutic type massages, so our clients kind of expect this, but you want to make sure you don't just go halfway up and stop. You can go sideways. I like to go across the muscles. I'm not pressing hard with my elbow as much as my forearm. I don't know if you can see Ashlyn, but go across. Right when you feel that tight spot, you can just hold that for a second. Or if you see them shaking, you may want to back off a little bit.
Or holding it.
I backed off. Is that better?
Yeah,
A little bit.
I just breathe.
So she just said a little. We're going to just not do forearms. I'm just going to do hands like that. That a little better?
Yes.
All right. As I said, a lot of lower back pain can stem from the groinal area as well. I like to bend their knee up, come out, so I can bend it out, tuck right there. You may want to come on this side to see it. I'm not sure if you can see where
I'm hobbling, I'm sorry.
I was just waiting for you to trip.
Me too.
Hurt the other knee.
I'd be even.
Okay, so as you see, I'm working on the inside of the leg. Can you see where you're at? You may want to come on this side. And then I like to put a forearm just to cover more area. And then also because definitely with being a male therapist, I feel more comfortable using a forearm as opposed to my hands just because, I think obvious reasons. Gonna work all the way up. Plus, these spots are gonna be pretty tender, so covering it with more surface area, like a palm, if they're comfortable with it. See how I'm kind of moving their leg in as I'm pushing out. We can do a little stretch for the hip flexor. I'm going to put my outside knee under their leg, so kind of mid-thigh area. Going to have them actually activate the stretch, so go ahead and push down with your hip. And we'll go forward. Say when. Okay. Now, were you just saying the word when, or was that actually when?
Yeah, when.
She's just good at following directions. No. And again, we'll have them push down and lean in. I usually hold for maybe like 3 to 5 seconds, depending on the person. Now, don't do this if they feel this in their lower back. If they feel the lower back, you want to release that a little bit more. All right, next, assume I've done both sides already. We're going to have her turn onto her right side. I like to cover a bit over here. No, onto your side. Right side. There you go. It's okay. Scoot down towards your feet. All right.
I don't even know where you want me to stand, honestly. I was like,
You just play with it. Probably right now, come on this side.
okay.
Because the first thing I like to do a test to see if their glutes are activating properly. Because if they're not, that can be a big sign why their lower back is having issues, because either their quads are doing a lot of the work, or their hamstrings are doing more of the work where they shouldn't. So I'm going to lift their leg up, put it into your hip,
I'm just
and I'm holding under her knee. I like to have them push into me, so go ahead and push. And then a lot of times, if they feel it right through here on top, tell them, well, what I want you to feel it is right here, so we can activate that muscle. I try to press on that area to kind of make them aware of it. So where do you feel it? Do you feel it back here? Or do you feel it up here?
There.
Up there? Okay, good example. So what I'm going to have her do is just keep pushing and then focus back here. Let me know when you start to feel it back there. She's like, I don't feel it.
I don't feel it.
All right, you want to give them a break? Take a second. Stop pushing me. All right. Do it one more time.
Okay, now I kind of do.
Now she does. Okay. And that activates that muscle. You make them aware of it. Had she not been able to, I would teach her some exercises that's on my mobility and stability training playlist that would help strengthen this muscle. So we're going to hold it there. There we go. Now we activated that muscle. Now I'm going to have you come on this side, Ashlyn.
Okay.
So I'm going to have you bring your arm up and over the sheet. There we go. Perfect. Excuse me. So what next thing I do is I can tuck under here, and you can actually work on top of their hip again. So actually, Ashlyn, come on this side.
I'm so sorry, people. I can't video. Where do I... Here?
So
Okay.
see where my hand is? So here's that bone. We talked about it earlier. Like I said, we want to push all that tension away. I like to put the muscles in different positions and release them that way as well. That way, they're not just good in one position, and then, that's like if you work someone with their legs straight the whole time. Well, as long as they don't bend their legs, they're okay. But you gotta work on the sacrum with that thumb a little bit. You can use a fist. I'll also do this to prenatals as well. I have some prenatal videos. So next what you can do, put your arm along the bone right there. Trying to get toward the piriformis muscle. And then raise your left knee into the air. She's like, really? You have to work out? Left knee up. There you go. And down. And see, that's an active release of this glute. We're going to do it again. She's like, why not sign up for this? No, she's just a star employee, I'll tell you that. All right, and relax. Good. That helps actively release that. And also you can tell that's one of the exercises she needs to be doing if it's that hard. All right, another thing, I really like this technique. I like doing it on both sides as well. It also helps, because a lot of people are very strong on the front side. I got you covered, don't worry. But they're weaker back here, so we want to have them activate that. So I'll have them, and remember, you have to have them look at it, so look at your hand. Stay looking at your hand the whole time. When you hold this here, I'm going to hold their hip right here, because what this is going to do is going to open up this entire area. And if I have them do it, it'll stay that way because they're they were strengthening that muscle in a pullback. If I do the work, it's just going to bounce back. So, plus helps her mobility. So, you see my hand over here? I want you to come over and touch it. Turn your head, turn your eyes. There you go. Touch my hand. Sometimes you get a good pop out of there too. All right, go back. I'm holding that hip right where the sacrum is. Sometimes it helps if I put my elbow into my hip. And then come back. Breathe. She's not a good breather. And back.
I was holding my breath with her.
Everyone was holding their breath. I wasn't. But that's a good way to, and I would do that probably a couple times. She made it all the way, so that was good. And then another thing I would also do is have them activate. If I wanted to release their pec a little bit better and it wasn't releasing when I was working on it, I would actually have them push against me. So try to push me and let go. And then I'm going to do my little stretch, push against me and let go. Push and let go. Good. All right. Now, she's going to feel so lopsided for only doing one side. Go ahead and lay on your back. Gotcha. And we're going to continue this left side. There we go. One thing I really like to do with as far as knees, you want to look at them. And when I first started working on Caitlin, her knees used to buckle in like this. Do you remember that? Mm-hmm. I bet. Well, as doing those rib cage clam exercises where she was raising her knee, I've been having her do that regularly and helping her do the pelvic releases with the knee up when my arm was sinking down in there. That helped really open this. So now she's not that bad. Another thing you want to check is their leg length. I like to have the bolster out actually right now, but for this video I won't. But what you'll do is just kind of get them to relax, drop them a couple times so they don't tense up. And come over here, Ashley. You want to measure their toes, see if they're about even. They seem about even right now, so that's good. A lot of times it'll look like this. And that would mean their right hip flexor is really, really tight. It's anteriorly tilting their right hip, which would need a lot of releases in that, and then some other techniques to get those to be even again. But if you come back on this side, Ashlyn, I'm giving Ashlyn a workout. All right.
Great times.
So we're going to jump in and do some hip flexor quad work. Don't worry, I know to not push too hard. Her quads are very sore a lot of times. So when you're working, she confirmed that. When you're working the hip flexor and quad area, you don't want to just stop here, just like the hamstring. I like to get all the way up, but into the bone up here, the pelvic bone. Again, with the client's permission. Get the full muscle group. All right. Now I won't use my forearms, but a lot of times I would actually go across my forearm and work my way up. Go across with a little bit more pressure, but right now I'm not. And I would go all the way up into this hip, and I would lean into that and hold. That helps as well. Another technique you can do, you can actually have them scoot towards you. So go ahead and come this way. And Ashlyn, you may want to come on this side. What you'll see now is I like to hang their leg off. You can see her leg hanging. Mm-hmm. As long as this isn't hurting her lower back, I'll actually lean her leg, kind of flex it. Flexes the hamstring, lengthens all this. And I would do the same kind of work up into the top of the hip flexor. If needed, if there's something wasn't releasing really well, you could even do an active release, get right on top of that muscle. And you know you're on it when they laugh like that. And then you actually have them raise their knee up towards you, but I'm not going to have her do that because I don't want her to hit me later when the video is over. So, but that's how you do some active release on that quad and hip flexor. All right. Next, what we do is bend the leg out. This is actually a really cool observation. You can actually, if I press on down on this knee, if this hip is coming up in the air, that means the groin is extremely tight along with some muscles through here. What I like to do is actually have them push their hip down while I work on the groin a little bit. So you keep that hip down. When it comes to groin work, make sure you communicate with your client. I know her comfortability, but on how high to go. Some clients who are like runners and stuff like that, they may need you to work a little bit more detailed, but make sure you build that relationship up, so a good trusting environment. But I'm doing palms. When you get in those little tighter areas, if you have a client where you bring their knee across, like you're stretching their hip, and they feel it in their groin, this is a good example. You can actually press into there. You feel that a little bit?
Yes.
Okay, then you can have them actively release it by raising their knee into your hand. And relax. And again. And relax. Good. Then, or next, I would like to put their, I like to do a lot of pelvic openers. So, same thing. Don't put your hand on their knee, but come up here on the quad. Sink in. And lean down into it. And I want them to actually activate this muscle. Push your heel into my hip. And relax. Push. And relax. I'm sinking a little bit deeper, as you can tell in her face. And then we're going to do a little psoas release. There's many ways to do this, but what I like to do right here. Actually, you may want to come on this side. So, maybe hard to see through blanket, but here's the bone right here. So what I want to do is first I'll press into this part of the bone, the top part, and I'll kind of sink down. I'm not going to do it too hard on her right now, but I want to sink down, and then if I wanted them to actively release this, I would hold that, and I would have them bring their knee up. Sometimes I'll have them come out with it and back in. If I want to do it for passively or the nice way, I would hold in there, come up, and you can actually feel the activation in there. Go out, go in, and then I'm going to come a little lower into the mid part, getting closer to the belly button. Still on the inside of the hip bone though. Go in, out, up. You see that smile, she's loving it. And then one more, I like to release some of that rectus abdominis. Kind of, in order to find this, what I like to, how I do it, you get their belly button right around here. If I'm pressing on it, pushing through a blanket in it. But anyways, I like to go about down, about a centimeter, come over, and then you'll find it right in there. And they'll confirm that. How's that feel? Like I think it does?
Yeah.
Okay, so, and then you're going to have them come up again. Remember, if you wanted to do it a little bit more intense, you'd have them do the lifting. This helps really get those hips to relax. What time are we at on the video? How long?
24 minutes and 50 seconds.
All right. Alrighty. Can you skip back to the middle? What we're going to do next, actually, is a pubic bone alignment technique. But I will, before that, I will let y'all know, a lot of times if you've done all this and their lower back hasn't relaxed or released all the way, then I would actually do some abdominal work. We're going to save that for another video. That way it makes y'all watch more of my videos. But for now, I'm going to bring her knees up. One way also you can get them to strengthen those glutes, having them do bridges, and by pushing up through their heels, raising their pelvis up. And what I'm going to do first is I'm going to squeeze together her knees, and I'm going to have her pull her knees apart, and then kind of raise up a little bit through your heels while pulling apart. Pull apart, pull apart. You should feel that in your like sacral area, the lower back.
Yeah.
You feel that there, and then go down. And again, we're going to pull apart and come up. Pull, pull, pull. Just focusing more on the up than the pull. And down. Look at that strength, though. Good job. And then the next part, so that's for the SI joint. This next part is for the pubic symphysis, to align the pubic bones. This is really good to do to pregnant ladies. Because as you know, as their stomach gets bigger, this aligns a lot of the ligaments and everything. So go ahead and squeeze together. Hard as you can. You're not going to break my arm. Can you show them where my arm placement is? Good. Squeezing and lifting.
And breathing.
As they lift, she won't breathe. I've learned. I've tried to get her to breathe so many times. I figure eventually she's going to breathe or pass out.
Yeah.
Go down. And then we'll do that a couple times. Come up. I like to rock and squeeze. A lot of times, sometimes you'll feel that click. Or you'll hear it sometimes. Go down. And then lastly, I like to bring their feet together. I'm going to go this direction with her hips, keeping her knees apart. Turn your head to the right. Go all the way across. Head to the left. I'll usually do this maybe about 3 to 5 sets. It should feel pretty good. Does it?
Mm-hmm.
Okay. She's like, in comparison to digging into my stomach, yeah, this feels great. And then again, left. And relax. All right, guys, I hope this does help y'all with some lower back techniques. If you have any questions, comments, concerns, or you just have some ideas you want me to do a video on next, I would love to help you guys out. So please subscribe and follow us on Instagram at Natural Forces Massage. Have a great day.